Moving ahead now and still talking health, the National Agency for Food and Drug Administration and Control has notified healthcare providers in the country and the public of the death of 66 children in the Gambia following the use of 4 substandard cough syrups. The agency, through its resident media consultant Shayo Akintola on Sunday, said that the 4 products are promethazine oral solution, cofexamine baby cough syrup, and Markov baby cough syrup, and Maghrib and cold syrup. Now, according to NAFDAC, laboratory analysis of samples of the products confirmed they contain unacceptable amounts of diethylene glycol and ethylene glycol as contaminants. It said that the toxic effects include abdominal pain, vomiting, diarrhea, inability to pass urine, headache, altered mental states, and acute kidney injury, which may lead to death. Till date, the manufacturer has not provided guarantees to the World Health Organization on the safety and the quality of the products. NAFDAC said that the products are not registered by the agency and should not be in circulation.